We're doing some very exciting work in training dogs to detect thyroid cancer in patient urine. And we initially started this because my really good friend, Dr. Arnie Ferrando, his dog was involved in scent detection with the police in finding bodies and in finding lost people. And he was bragging about how good his dog was in finding small amounts of blood or remains. And so we decided to try it see if we could get the dogs to detect thyroid cancer. And we started out by training his dog Frankie to tell the difference, distinguish between tissue that was thyroid cancer tissue and tissue that was not. And then we got urine and blood from patients that we knew had thyroid cancer. Unfortunately, they hadn't been cured and they still had disease in their lungs, neck, whatever, but we knew they had cancer. So we took urine from those patients and urine from people who had their thyroids out, but it was benign, and then we randomly presented them to the dog after he'd been trained to distinguish between the two. And in that study, we had a 97% accuracy rate for them to detect which urine samples were positive and which ones were negative. So the exciting thing about the study that we just completed is that it's actually done in the clinic. So patients would come to see me with a thyroid mass or nodules, and I'd get urine right away before I did anything else. And then the patients would proceed to have biopsies, surgery sometimes. But all of the patients in the study ended up having some kind of pathology where we knew it was benign or malignant. And the urine that we sent over, the dogs independently, I wasn't involved in that to keep it separate. The dogs independently read that urine and gave an answer on whether or not it was benign or malignant. And then later we joined the two data sets. And when we did that, it came back where the dogs were about 90% accurate. So not 100, but very, very good at detecting thyroid cancer in clinical patients. So not in just samples, but actually in patients themselves. And down the road, what we really want to do is, number one, get more numbers. In other words, we looked at 34 patients in this last experiment, but what we want to do is get the numbers up to make sure that this isn't a fluke. You know, we want to get 100, 150 patients. And then we want to branch out into other cancers. We're collaborating with a surgeon at University of Arkansas who specializes in ovarian. And that would be the one that we'd want to go to next, because ovarian is extremely hard to diagnose, and it would be beautiful if we could screen for high-risk patients that might contract ovarian cancer. So those are some of the few things that we're going to be pursuing in the future.